Dear colleagues, this is a short presentation of abstract 10034 on the single agent activity of anti-GD2 antibody dinutuximab beta given as long-term infusion in patients with relapsed and refractory neuroblastoma. The background for this study is derived of the previous use of dinutuximab beta, where it has been combined with other drugs that are active against neuroblastoma, such as interleukin-2 or isotretinoin, as well as in combination with chemotherapy. The response rates of those previous trials were reported in the range of 40 to 50%. And there's no study so far where dinutuximab beta has been used as a single agent, and therefore we conducted a prospective open-label single-arm phase 2 study to evaluate single-agent activity in patients with relapsed and refractory neuroblastoma who have at study entry a measurable or evaluable disease. The tumor burden had to be controlled by conventional therapy, and patients were planned to receive 5 cycles of 100 milligrams per meter squared of dinutuximab beta, given as continuous long-term infusion over 10 days per cycle. The primary endpoint of the study was the objective response rate 24 weeks after completion of the treatment. And as secondary endpoints, we had the best response rate, but also safety parameters, such as the intravenous morphine use, since the pain is an on-target off-tumor side effect of anti-GD2 antibodies. All the patients require IV morphine, and we evaluated how long and how much of morphine was really needed when this antibody was given as long-term infusion. We also looked at the 3-year overall and progression-free survival in this study. The patient characteristics are summarized here. So there's a typical median age at a diagnosis of such a relapse refractory cohort. The distribution of the disease status is 57% relapse patients and 43% with a refractory disease. At the initial diagnosis, the majority of patients had stage 4 neuroblastoma. There was 4 patients with a local initial stage, but those patients experienced a disseminated metastatic relapse at later time points and therefore were also included into this study. MYC amplification was found in 18% of the patients, and the bone marrow involvement at the baseline before entering into the trial was positive in 14 of the 40 patients. Let's look at the response. So we observed the objective response rate at 24 weeks after completion of the treatment at 26%, which was significantly higher compared to the expected response rate at 10%. The best response in the trial observed was 37%, including CR and PR patients. And if we also look at the minor responders, we have a response rate of 53%. The duration of CR and PR patients was 238 days, and the bone marrow response of those patients who had a bone marrow involvement was 93%, which is excellent for considering that this is single use of dinutuximab beta only in this particular trial. The survival at 3 years progression-free was 31%. The 3-year overall survival was 66%, which provides a strong signal of clinical activity compared to previous reports in patients with relapse and refractory neuroblastoma. And if we do a subgroup analysis, we find that refractory patients do better in terms of survival compared to relapsed patients, which is a result that has been also found in previous trials in relapse and refractory neuroblastoma. The safety observed along this long-term infusion was excellent. We did not observe any grade 4 treatment emerging adverse events. However, there were some grade 3. The most frequent was neuropathic pain, followed by diarrhea and hypokalemia. There was no grade 3 hypotension, capillary leak, or neurotoxicity observed in this particular trial. Now, the IV morphine usage was also decreasing from cycle to cycle, with no patients requiring any morphine as of cycle 4. And also the daily morphine use within cycle was also decreasing, and we could clearly show that this long-term infusion is beneficial for patients who receive this anti-G2 antibody. The pharmacokinetic and pharmacodynamic parameters indicated a sufficient antibody concentration at the end of infusion to mediate a biological effect, which was 10.8 microgram per milliliter. HACA response rate in this trial was 24%, and the application of the antibody translated into an immunological effect as determined by antibody-dependent cell-mediated cytotoxicity, which increased by a factor 7 above baseline in cycle 1. And also the complement-dependent cytotoxicity increased over baseline by a factor 11, indicating the effect of the antibody in patients who received this treatment. Interestingly, there was no correlation between the exposure to dinutuximab beta and response or survival, and this was analyzed very intensively. We looked at area under the curve, but also peak and through level, and as I said, there's no correlation to the response or survival in this trial. So to summarize, I think we could identify a clear response rate, which is not different from previous reports when dinutuximab beta is used here alone, in comparison to the other trials where it has been used in combination, indicating that the anti-GD2 antibody is the core component to an effective relapsed refractory therapy. There was an excellent safety profile when using this antibody as long-term infusion with no grade 4 adverse events, and a decreasing IV morphine usage with no patients requiring morphine in cycles 4 and cycles 5. So this leads to the conclusion that the long-term continuous infusion of single-agent dinutuximab beta is very tolerable. It's associated with a clinically meaningful response rate and survival, and I think it's an excellent drug for relapsed and refractory high-risk neuroblastoma patients. I'd like to summarize here and acknowledge a lot of people who contributed to the study. The SIOP-N group is the group that is leading pediatric oncologists in Europe, but also my team in Greifswald, and the funding institutions, but also Ralf Reisfeld, who invented the dinutuximab and also the dinutuximab beta. And he was really happy to see that one of his inventions made it to an active drug, and it's now helping children with neuroblastoma. Thank you very much for your attention.